Thank you so much for joining us today. My name is Katie Baker, and I am the Virginia State Director for Protect Our Care. We are a national advocacy organization whose mission is to strengthen and protect healthcare. And we do so largely through events like this one, where we educate and inform the public. Unfortunately, as to the devastating harm that Republicans in Congress are causing, not only to Virginians' healthcare, but also to state budgets here in Virginia. So if you received our media advisory, you should see that Protect Our Care Virginia has just released a new report that details some of the harm that you're going to see both to Virginians on Medicaid, estimating about 260,000 Virginians over the next decade could lose their Medicaid as a result of the cuts in the big ugly law passed last year. And we are also honored to be joined by Speaker Don Scott and my delegate, who is the chair of the House Health and Human Services Committee, Delegate Rodney Willett, who are going to speak a bit about what the impacts of those cuts are going to be as they're making decisions about our state budget. So really here to call out every Republican in Virginia's delegation who voted for this. That's my congressman, unfortunately, Rob Whitman, Jen Kiggins, Congressman John McGuire, Ben Klein, Morgan Griffith. Every Republican in Virginia's congressional delegation voted for this bill that will take Virginians' health care away and hurt our state budgets, all to fund tax breaks for the very wealthiest billionaires and corporations. And with that, I'm going to turn it over to our longtime friend and partner over at the Commonwealth Institute for Fiscal Analysis, who does a lot of analysis on the state budget, and that's Rodrigo Soto. Rodrigo.
Uh, well, thank you so much. And hello, everyone. And thank you to Protect Our Care for inviting TCI to join Speaker Scott and Chair Willett. My name is Rodrigo Soto, and I am the Legislative and Campaigns Director at the Commonwealth Institute for Fiscal Analysis. TCI is a nonpartisan organization committed to advancing racial and economic justice in Virginia, and Medicaid is a crucial tool in that effort. Back in 2018, TCI was part of a broad coalition of organizations who helped make Medicaid expansion possible in Virginia. The program is now helping over 540,000 Virginians access affordable, quality health care. Unfortunately, Republicans in Congress passed a budget bill last year that is expected to cut Virginia's Medicaid funding by $29 billion by 2034. Many of these harmful changes to the Medicaid program target people who are eligible because of Medicaid expansion and come in the form of additional burdensome paperwork and increased healthcare costs. Together, these changes to Medicaid are expected to take away health coverage from 260,000 people. This massive healthcare cut was passed by congressional Republicans in order to fund massive tax handouts to the ultra wealthy. So while 260,000 of our community members lose their healthcare coverage, the top 1% in Virginia are expected to get an average tax cut of nearly $80,000. With the federal government choosing to prioritize the wealthy and well-connected over low and moderate income people, state governments are having to take action. While former Governor Glenn Youngkin attempted to make additional Medicaid cuts in his outgoing budget by cutting famous prenatal, we are so thankful for Speaker Scott and Chair Willett, as well as our healthcare champions in the Virginia Senate, for restoring that funding in their proposed chamber budgets. Additionally, both the House of Delegates and Senate include $10 million in their budgets to support our free clinics and federally qualified health centers. The Virginia General Assembly understands the importance of helping our most underserved and vulnerable populations meet their health care needs early. Taking no action would result in uninsured people relying on emergency hospital visits, which are more costly to hospitals and the state budget. TCI remains committed to holding federal lawmakers who supported these healthcare cuts accountable and continue to call on these same lawmakers to reverse course. At the same time, we are so thankful for state leaders like Speaker Scott and Chair Willett, who remain committed to fighting to protect and strengthen Medicaid in Virginia so that people across our Commonwealth can access the care they need. And with that, I will give it back to you, Katie.
Thank you so much, Rodrigo. And I did just want to let reporters know we will take questions at the end via the Q&A box. So if you already know that you have a question, feel free to drop it now in the Q&A box just to save you the time. And with that, I'm really excited. Speaker Don Scott has been such a great champion for healthcare and partner to protect our care. We did an event last summer down in Norfolk with our partner SEIU, which was, obviously talking about very serious Republican cuts to healthcare, but we did have a lot of fun with the SEIU members at that event who have been amazing partners to protect our care. And with that, Speaker, thank you so much for joining us.
Thank you. Thank you for having me. When I first became speaker, my very first act was establishing the Select Committee on Rural Healthcare. I seen what was happening across rural Virginia, families struggling to find a doctor, hospitals hanging on by a thread. I went to Richlands, Virginia to visit my good friend, Senator Hackworth. He and my wife and I went down and we stayed with them for a while. We saw folks waiting for mobile health care in a grocery store parking lot, and we think we can do better. We had seniors driving an hour or more just to get basic care, communities wondering if the emergency room would still be open tomorrow. We knew a crisis was coming if we didn't act. That's why I tasked Delegate Rodney Willett to chair the Rural Health Committee and now the Health and Human Services Committee before that. And what did Rodney do? He got to work. He traveled every corner of the Commonwealth. He listened to patients, nurses, doctors, hospital administrators, and families, and he came back with a plan. Together, we passed bipartisan legislation and built a real framework to strengthen and protect rural health care in Virginia. That work matters. It still matters, and we have more work to do mainly because of the big ugly bill that Republicans in Congress passed to set us backwards, to send us backwards with healthcare. MAGA has not been good for rural healthcare in Virginia. MAGA has not been good for healthcare, period. The only thing it's helped is itself and helped its billion-dollar donors. We took one step forward and then they came back and took us two steps back before we can even get everything implemented. And let's be clear about what that means for Virginia. Nearly $29 billion cut from Virginia's Medicaid program over the next decade. More than 260,000 Virginians projected to lose their health insurance. 16 hospitals at risk of closing, and some have already gone. The very hospitals and health systems we fought so hard to protect. Not because Virginia failed, not because our communities failed, but because politicians in Washington decided tax breaks for billionaires mattered more than keeping hospitals open in Southside and Southwest Virginia, Shenandoah Valley, and across rural communities in this Commonwealth, as well as communities like mine here in Portsmouth. But here in Virginia, we did not sit on our hands. The House introduced a budget that funds Medicaid and CHIP forecasts a net increase of $2.4 billion. We created a $200 million federal unanticipated contingency fund because we knew with this current president giving him and his family a pass in IRS and a $1 billion slush fund, we knew more chaos was coming from Washington. We invested nearly $80 million in premium assistance for Virginians losing federal tax credits. And we put another $10 million into free clinics because when hospitals close, those clinics become the last line of defense, unfortunately. And that is all being worked out in our budget negotiations now. But even with all of that, it still may not be enough to fully undo the damage, the harms that this Republican Congress has ravaged on our communities. That's the hard truth. You can build a roadmap, you can prepare, you can do the responsible thing as we've tried to do, but none of it matters when somebody in Washington comes along and blows up the road. And the people who made these decisions, they need to be held accountable. Jen Kiggins, McGuire, they need to be held accountable for every hospital that closes, every family that loses coverage, and every Virginian forced to pay the price for their recklessness. Because healthcare should not depend on your zip code, and no Virginian should be left behind simply because they live in a rural community or in any community in Virginia for that matter. So I want to thank you, and I will hand it back to Katie.
Thank you so much, Speaker. Thank you so much for being such a champion. And just to echo what you're saying about those rural health facilities in particular being at risk of closure, I went down to Tazewell last summer with Congresswoman McClellan to sound the alarm. There's a hospital down there at risk of closure. We saw Augusta Health has closed 3 clinics, I believe, in
Yep.
Congressman Klein's district. I just did an event with Protect Our Care and Planned Parenthood. We went up to Tappahannock. There's a hospital at risk of closure there in Congressman Whitman's district. And Senator Warner did an event with us last fall in Franklin, and the hospital there is also at risk of closure. So this is very real, and we're going to continue to sound the alarm and hold these guys accountable for potentially closing hospitals that are in their own districts. And with that, it's definitely my honor, Chair Willett. It was a pleasure listening to you, Speaker, talk about that rural health committee because I got to go down to Tazewell. I guess before I went down with Congresswoman McClellan, my first time down there was with you, Chair. We went down there for one of I think it may have been the first meeting of your Rural Health Committee, and met with some press down there and heard some very powerful voices. So thank you for inviting Protect Our Care to tag along there. And with that, it's my honor to introduce Chair Willett.
Katie, thank you so much. It's an honor to be with you and certainly with the speaker and work with Rodrigo for years too. So I'll echo some of the things they said, but I will start by saying thank you. Thank you to our speaker for having the vision and the understanding, the appreciation for the gravity of these issues. There were issues before the big ugly bill that he recognized as he told the story from 2024, and that's why he appointed me to chair the Select Committee on Rural Health Care. We did go out and listen to the people. We went around the state with a series of meetings. We developed recommendations, and now go into details on that as we did our work. But the purpose really was to listen to the people, and we talked to nurses who were doing double shifts because there's a staffing shortage, and that's actually true not just in rural areas but across the state. We met with a number of hospital administrators, including each meeting. We had the CFO there because we wanted to see the numbers and what they were dealing with their populations. And even on a good day, they were on very thin margins. But what we saw in 24 were hospitals barely able to keep labor and delivery units open, other specialty care. Now with the big ugly bill, the lights are out. And we're actually losing hospitals. You've heard reference to as many as 16 hospitals closing across Virginia, and just trying to think about families who already have to drive a pretty long ways to get to a hospital. Think about an even longer drive. And the same was true for clinics. We saw folks that were driving upwards of 90 minutes. When you get an area like Tazewell, something maybe 20 miles away, but it could be 90 minutes away because of the mountainous area that is. And that's if you have transportation to get there. We heard time and time again, people simply lack basic transportation. So what's happening is if they're even fortunate enough to have a doctor at a facility and they can get an appointment there, a lot of times they can't get there. And if they do get there and let's say they get a prescription, then the pharmacy is another hour away. So a lot of people, even if they get seen by a doctor, they're foregoing the medications. And then ultimately, the only health care they're getting is when they go to the emergency room, if they can get to one of those. So many families we talk to in areas, Medicaid is really their only health care, only access to health care. They're trying to take care of family members may suffer from Alzheimer's or have a child with a disability. Those families are literally one paperwork mistake away from losing their health care. These are the kind of stories that really stayed with us. And to the speaker's point, we did come back to him with a bipartisan set of recommendations, bills, and budget amendments. We passed those amendments and laws and really made great progress trying to stabilize the rural health care and protect the most vulnerable hospitals. That included expanding telehealth, more remote patient monitoring, free transportation, more free transportation to appointments. Also focused on maternal health. A lot of those efforts led to the Momnibus. We now have Momnibus 2 as we're still trying to work there. And then a real deep focus on growing our health workforce. Again, that's a statewide issue, but particularly acute in the rural areas. So incredibly proud of that work. But we've got to be honest where we stand today. And to the speaker's point, uh, the big ugly bill is going to take away nearly $29 billion out of Virginia's Medicaid program over the coming decade. That's taking people off of coverage, is taking subsidies from hospitals. To the point that was made earlier, 16 hospitals could close. Some of the clinics have actually already shut down. And these are in the communities that we visited that are the most vulnerable, and they're the ones that are going to be the most impacted. These are the ones we were trying to save. The incoming Medicaid requirements. These reporting requirements are daunting. The work requirements is daunting, and it's clear there's one purpose to those requirements, and that is to get people off of Medicaid, and then to give the savings back to the wealthy. That's the formula, and they're not hiding. I will give them credit for their honesty. They said, yes, that's exactly what we're trying to do. We want to take people off of Medicaid, use that savings to fund a tax break for the wealthy, and that's exactly what's happening. It's a $1 trillion hole. Those increases, I think was mentioned earlier, this is a systemic impact. So what happens is you take people off of Medicaid. We've also had cuts to the Affordable Care Act subsidy, but you take people off that health coverage, they've got a couple options then. One is to go to the emergency department, and emergency departments are already overwhelmed. The other is to go to the free clinics. Well, the free clinics are projecting as many or maybe more than 10,000 additional patients coming on board if they lose their Medicaid coverage. That's just daunting. And to the speaker's point, we have put funding in to the budget to try to make up some of that deficit. But when you talk about upwards of 260,000 Virginians being affected, that's a multi-billion-dollar impact. And as much as we want to try to close that gap on an ongoing basis, that's daunting. So again, this is not an accident that we got to where we are. It was a choice made by this Republican administration. It was a choice to prioritize tax breaks for billionaires over health care for working families. And now that's a choice whose consequences are going to be felt in rural communities across Virginia every single day. I will say, just to emphasize this, the speaker has reconstituted the Select Committee on Rural Health Care. We're going to have our first meeting, hopefully at the end of June, and we'll be on the road again, going to the Shenandoah Valley, hearing directly from providers, from families who are dealing with these impacts. We thought there were challenges before, and now look at what we're dealing with. So we're going to cover the state again and try to come back with some answers. Thank you, Katie.
Thank you so much, Chair. Thank you for everything that you've done to fight for healthcare, especially rural healthcare. And just listening to what you were saying about those work reporting requirements, yes, they're absolutely designed to throw people off of Medicaid. Most people who are on Medicaid are already working. And not only are all those people going to get thrown off and then become uninsured, but it's also costing the state money to implement the work reporting requirements as required by the federal government. Rodrigo, I believe you were telling me it was like 134 million over the biennium was currently budgeted for that, which is just really unfortunate. And those members of Congress, Congressman Whitman, Kiggins, McGuire, like they all need to be held accountable, not only for taking people's healthcare away, but also for the costs that they're imposing on our state budget amidst a range of federal cuts that our state legislators are being forced to navigate right now. And with that, thank you again to our speakers. I do want to turn it over to Fletcher to moderate our Q&A. I believe we had a submitted question from Michael Pope. Fletcher, if we wanted to kick it off with that.
Yeah, thanks, Katie. And just as a reminder to media on the line, you can use the Q&A box at the bottom of your Zoom screen to type your question out. And we can start with a question from Michael Pope. And Rodrigo, I will direct this one to you. So the new work requirements would end coverage for 1/3 of the population who got insurance through expansion. What about the rest of the people? It wouldn't jeopardize their coverage?
While there's specific coverage may not be jeopardized, I think as the speaker and chair accurately mentioned, many clinics are already beginning to close, and they treat people, whether you're an expansion population or just on regular Medicaid, people need to go to those places. So, and if you lose them, you're going to have to start traveling longer distances to find another provider that even accepts Medicaid. Not all providers do. and that becomes a barrier to healthcare access for everyone, regardless whether they're in the expansion population or in the just enrolled under regular Medicaid. So while many of the changes from the federal law specifically target the expansion population, the impacts will be felt to all Medicaid recipients. And actually, even beyond that, when a hospital closes, hospitals treat everybody. They are where people, regardless whether they have private insurance, whether they're completely uninsured, or whether they're on Medicaid. So that closure will be felt by everyone in our community. So that is a big loss as well. So that's it's not just thinking about those in the expansion population, but the ripple effects it'll have across Virginia and the country.
And if I could just jump in there too, a couple other things I was thinking about as you were speaking, Rodrigo. The Big Ugly Law also defunded Planned Parenthood. So, like, I go to Planned Parenthood, for example, for preventative care. Like, even if you're going for preventative care, cancer screenings, contraception, if you're on Medicaid, you can no longer have Medicaid pay for you to go to Planned Parenthood, regardless of whether or not you're in the expansion population. So, you might lose your trusted provider due to that provision of the law. And then one other thing I was thinking about, we did an event with Senator Kane, I think back in December, where we heard from some families who have children who are eligible for the Medicaid waiver. So that means that they have a severe disability that makes them eligible for Medicaid. So they would not be part of that expansion population. And some of those parents were saying, and this just shows how all of these cuts are related, they're actually worried about losing their family's trusted provider, caregiver for their children, because a lot of those home care workers rely on their health care through the Affordable Care Act tax credits. And now that those home care workers, and I work with some of them through SEIU, are losing their tax credits, they're losing their health insurance and maybe looking for jobs where they can get insurance. So just wanted to note that as well, and then turn it back to you, Fletcher.
Thanks, Katie. We do have a question coming in from Drew Wilder with NBC Washington. This is for you, Mr. Speaker. Can you address broadly the scope of the governor's vetoes and what you think it says to Virginians? Secondly, you can address the veto of the can you address the veto of the bill that would establish a prescription drug affordability board?
First of all, thanks for the question. I think the governor's vetoes broadly, obviously across the board, the legislature put in a lot of work in those bills, sending those bills to her desk. It's always her prerogative. We have three co-equal branches of government for a reason. There is nothing that she has done that I can say I'm surprised by. I can say that there are a couple that I'm disappointed by, but I'm not despair. I think those issues can continue to be worked on, and I think there are ways that we can continue to move forward on those issues. That's my overall view of that. When you think about it, I think people need to remember this. She signed or will sign as of today, of what I'm hearing, 1,132 bills. Okay. So a lot of things that we got done and passed through the governor signed. And I don't want to spend a lot of energy focusing on the whole. I'd much rather talk about the donut, which is what we got done this session. Now, regarding the prescription affordability drug, that was a bipartisan piece of legislation that we worked really, really hard to get Republicans to come on board with us on as we continue to try to lower prescription drug costs. We put caps on insulin. We made prescription drugs more transparent. We've done a lot this session to work on affordability. That's one that I'm disappointed in, but I'm not, like I said, I'm not despondent. I think that's something that we'll continue to work on and work in conjunction with the governor to get some of this issue across the finish line. And I will remind people again, she signed 1,132 bills.
Thank you
Didn't
very
happen
much,
when
Mr.
Jane
Speaker.
Youngkin was governor.
Thank you, Mr. Speaker. We have a question coming in from John Khalil with VPM News. And Mr. Speaker, I'll direct this to you as well as you, Chair Willett. We got some of the governor's final actions today, and it's looking like she will have vetoed all but four bills, two pieces of legislation on legislation that her amendments rejected. Given that the state budget is coming up and has money for the enhanced ACA subsidies, what sort of collaboration and communication are we seeing between the governor's office and legislators, both on this issue and broadly? Has communication improved since session?
I'll let Rodney go first.
Thank you. No, well, I can speak directly to the ACA subsidy because I'm carrying that budget amendment. Barbara Favola has the Senate version, and I can tell you from the get-go on this issue, we've been collaborating with the governor's team. The question really was just trying to do the math as to how many people, how many Virginians who are losing coverage now or foregoing coverage, can we afford to get back on the plan? You've heard a couple of times today. This You make a change to one part of the system, you affect the whole system. You mess with Medicaid, you're messing with the whole system. ACA is part of that. People are relying on that for healthcare. We have over 410,000 Virginians who got healthcare because of this marketplace, and now we could lose 100,000 of them. The trend lines are horrible. And so, yes, we did come up with some funding. It was a very collaborative effort with the governor's office to develop those numbers. I wish we could afford to cover every single person who's losing the subsidy. That was a bridge too far, but we're going to cover, I think, tens of thousands of Virginians with what we did propose. And I'm confident that's going to go through.
And I will add, I spoke to the governor yesterday. I think some of the things that we continue to do is work on communication. I can only speak for the House. I don't want to speak for the Senate. I think they may have a very different viewpoint, but I think we have been communicating. I'm the type, I just think these things are to be expected. We have a very strong leader in the governor, very strong leader in the Senate, and it doesn't surprise me that we have different points of view on some important issues. And so I think overall communication is going about as well as can be expected. And I think when you're in these difficult policy choices, sometimes the best thing to do sometimes is to continue to try to push forward. Regarding the expanded the healthcare insurance, I think we're going to get it done. I feel confident. Delegate Willett is leading the way as the chair of Health and Human Services Committee. I feel very confident that he's going to be able to negotiate position and make sure that we get as many people covered as possible. That is what we're trying to do. We are trying to make up for the impact that the big, beautiful, or big bullshit bill had on our communities. And I think we have to continue to call out MAGA Republicans. I don't think it's wise for Democrats to fight with one another at a time when we have a president that is run amok in our economy, sending our kids to war in a war of choice that nobody understands why we're there. And at the same time, every time he moves, he's pulling money from the American taxpayer and putting it in his pocket and his family's pocket. And so I think we need to stay focused on the main thing with that, and that Democrats here in Virginia, we're focusing on making sure that we put money in people's pockets here, that we make things more affordable, healthcare being one of them, housing, keep our communities safe, making sure that we fund our education system. Those are the things that we're focused on, not on a tit for tat and who's talking to who with the governor or not. These issues are too important for us to get caught up in personalities and styles when people are counting on us to deliver.
Thank you very much, Mr. Speaker. I think that is all the time we have for questions for now. So, Katie, I will turn it back to you.
Well, thank you. I just want to thank you, Speaker Scott, Chair Willett, Rodrigo from the Commonwealth Institute for taking the time to join us today. And really just to reiterate, we have Republicans in Congress who are the ones who put us into this situation where we're talking about 260,000 people plus an additional 100,000 people on the Affordable Care Act, in addition to those who could lose Medicaid, are going to be losing their health care because of this vote for this big, ugly law. And the people responsible for that are Rob Whitman, Jen Kiggins, John McGuire, Ben Klein, and Morgan Griffith, period. So thank you for joining us. Thank you for being champions. And with that, I will let everyone get back to your day. Thanks all.
All right.